Nowadays, I do this surgery through a minimally invasive approach. I can give you an incision that's about an inch long and still give you an excellent repair, actually a more robust repair that allows you to get back to the things that you want to do quicker. So one of the most common sports injuries I see in the foot and ankle is an Achilles tendon rupture. Now, typically, these are very obvious acute events. A patient is performing a movement with acceleration. This will often happen during a sporting activity such as soccer or pickleball or basketball, when a player performs an acceleration movement and they feel a snap in the back of their ankle. When a patient presents to me, what I typically see, there's a lot of bruising, a lot of swelling around the ankle. Typically not a lot of pain though. The patient will typically complain of weakness and the feeling that the foot is just not attached to the ankle anymore. I perform a test called a Thompson test, which is a way for me to evaluate the integrity of the Achilles tendon. And I can tell you whether that tendon is completely torn or just partially torn, which will guide the treatment moving forward. So when I see a patient with a suspected Achilles tendon rupture, typically a physical exam is adequate to make that diagnosis. Occasionally I will use other tools, which will typically involve either an MRI or an ultrasound to confirm the diagnosis, but most of the time this is not necessary. If a patient has an Achilles tendon rupture, then we sit down and we talk about options. Traditionally, we would treat all of these surgically if a patient was healthy and active. And if there were lots of medical issues, a patient would be treated non-surgically. Nowadays, we can actually have excellent outcomes with non-operative management. So I do talk to my patients about that, and we assess whether they are a surgical candidate or a non-surgical candidate. And I treat both of those moving forward. Traditionally, when I would repair an Achilles tendon, it would involve a large scar, a large incision about 5 inches down the back of the ankle. Nowadays, I do this surgery through a minimally invasive approach. I can give you an incision that's about an inch long and still give you an excellent repair, actually a more robust repair that allows you to get back to the things that you want to do quicker. We've really optimized the rehab too, which I think is critical. I work hand in hand with the physical therapist to get you walking as quickly as possible, in physical therapy quickly as possible, out of the boot, and back to the activities you like to do.